and misinformation about our policy. Well, let me just clear them up, Mr. Speaker. User fees at hospitals was just one barrier to the free and timely access to health care, and we removed it. The cost of medicines was another barrier, and we enhanced the drug serve pharmacies and the Drug for the Elderly program and covered the cost of certain critical medicines as part of our access to health care policy. The functional state of health centers was also a barrier, and we started a program to refurbish, repair, and equip several health centers around the island to ensure that primary health care was functional and accessible in all communities across Jamaica. Our policy of health care was not about user fees. It was about access. It was about giving Jamaicans a chance at a healthy, prosperous life. Our policy on health is to remove all barriers to accessing health services at the time of need. That is our policy. There are other barriers to access that still exist and must be addressed. The structure of health financing, public information and education and empowerment regarding lifestyles and healthy choices are key among them. Mr. Speaker, were it possible, the government should make the necessary allocations to cover an agreed standard of health care to allow Jamaicans to access health care as needed. But as we all know, it is not going to be possible for Jamaica in the near future if our economy doesn't grow. And even then, government priorities are subject to change. There is always going to be a funding gap between what government allocates and the demand, quality, and extensiveness of the service required. Charging an upfront user fee under a cost-sharing arrangement to cover the funding gap is the most inefficient way of financing the provision of health services. The fee is usually not affordable. It cannot be collected under all circumstances. And it is impractical to try to assess patients' ability to pay when they turn up sick at hospitals. The most practical way to finance the funding gap is through the establishment of a health insurance scheme. Mr. Speaker, the 2012 Survey of Living Conditions reports that approximately 19% of Jamaicans have health insurance coverage, and approximately 22% of those who were ill had health insurance coverage. As a first step towards filling the financing gap through health insurance, our administration started the process of interfacing the private health insurance system with the public health system. We started it.
Listen, go back to your...
Started. No, it started. It started here. So,
You objected to it? Just go back to your BlackBerry there.
this, Mr. Speaker, was to facilitate the billing of private insurance schemes whose subscribers use public health services. I recall that the Minister of Health, the current Minister of Health, came to Parliament with an announcement regarding this important aspect of financing health in Jamaica. The Minister should update the nation on this. Mr. Speaker, the Labour Party proposes to establish a contributory national health insurance scheme for wellness and the advancement Mr. Speaker, the member from West Central St. Catherine when he was the Minister of Health, Ken Baugh, had started work on developing such a scheme. I have asked him to continue his work on this as a special project. Already, there is a resolution on the order paper in his name, and when it is being debated, we will give more details as to the proposed structure of this health insurance scheme. In 2009, former Prime Minister had outlined the position of the Labour Party administration with respect to the free access to healthcare policy. The commitment was given to dedicate the fees from the renewal of casino licenses to the health sector. That commitment still stands, and those fees would now form part of an income stream to the National Health Insurance for Wellness Advancement Scheme. This approach represents a more reliable, equitable, and affordable framework for financing the delivery of public health in Jamaica. No one will have to worry about the inconvenience or sheer humiliation of having financial considerations standing between them and the treatment they need at the time they need it. Mr. Speaker, while the state is responsible for the provision of health care, we must reinforce the point that every citizen is responsible for his or her own health. We are personally responsible for our health. Information and education improves our ability to make choices in exercise of this responsibility. The measure of a great health system is not the number of illnesses it cures, but rather the reduction of disease within the population. Simply put, Mr. Speaker, prevention is better than cure. Mr. Speaker, the 2012 Survey of Living Condition notes that approximately 25.8% of persons surveyed report that they had a chronic, non-communicable disease. Diseases such as diabetes, heart disease, hypertension, arthritis, and asthma. While this was the same in 2010, what changed in 2012 was that more Jamaicans are reporting having 2 or more of these conditions. So, Mr. Speaker, the situation, though not expanding in the population, it is getting worse within the population that has disease, non-communicable diseases. In 2010, only 19% had 2 or more chronic non-communicable disease. In 2012, 36.4% reported having 2 or more such diseases. Hypertension, Mr. Speaker, affected 11.6% of respondents and is the most prevalent of the chronic diseases, followed by asthma at 5%. Both diseases, Mr. Speaker, show signs of increase over the 2010 figure. Mr. Speaker, the cost of health care due to accidents and violence is significant and remains a cause for concern. The age group 10 to 19 accounted for almost a quarter of all